Hi, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Judith Sears-Poisson, and I'll be your host today. Our webinar is on access to financial systems and advancing well-being for vulnerable communities and individuals, and we're very fortunate to have three great presenters with us today. First, we'll hear from Dr. Julie Birkenmaier, who is a professor of social work in the School of Social Work at St. Louis University. She'll share the landscape of financial access and what the implications are for financial well-being and stability when there are barriers to accessing necessary services. Next, we'll turn to Dr. Megan Doherty B., an assistant professor of consumer science in the School of Human Ecology here at UW-Madison and an IRP affiliate. She'll build on what we learned from Dr. Birkenmaier and will give us a deeper look at what financial access, or the lack of it, looks like on a neighborhood level. And then we'll hear from Karen Murrell, the founder of Higher Heights Consulting and a project manager for the Asset Funders Network. Karen will provide examples of innovative and effective policy and practice solutions to help alleviate obstacles to financial well-being, particularly for disadvantaged communities and individuals. This webinar is supported in part by funding from the U.S. Department of Health and Human Services Office of the Assistant Secretary for Planning and Evaluation. But views expressed by our speakers don't necessarily represent the opinions or policies of that office or of any other sponsor, including the University of Wisconsin-Madison. We have an hour today, and after we hear from each of our presenters, we'll spend the last 15 minutes or so with a live Q&A. You can type questions into the Q&A box, and we did get quite a few questions submitted as you all registered, so we'll be queuing some of those up as well. And again, hope you'll feel free to participate through the chat. We love to know who's joining us. I want to let you know that we have closed captions enabled, so you can toggle those on and off at the bottom of your screen. And we'll be posting the slides and the recording of the webinar within a day or so, and you'll receive a link to those by email if you registered for the webinar. So with that, thank you again for being here, and we'll get started with Professor Birkenmaier.
Great. So let me go ahead and share my screen. And get started. So I'm hoping that you can see my slides. I'm Dr. Julie Birkenmaier from St. Louis University School of Social Work, and I'm really happy to be here. I'm really honored to have been asked to join this esteemed panel. I'm going to speak for just a few minutes, very briefly, really, about financial access and its relationship to financial well-being. And in doing so, I hope to lay the foundation for some of the programs and policy conversation happening later from my co-presenters. So in terms of background, when we think about financial well-being, we think about kind of a variety of things. Sometimes we think about objectively how much income or wealth people have, or subjectively how people feel about it. So there's a wide variety of ways that we can approach financial well-being. But we do know that there is a good portion of the US population that struggles overall with their financial well-being. About 30% of US adults do not view their financial situation as at least doing okay. So we know that people are feeling it out there. When we talk about financial well-being, as I mentioned, it could be thinking about it objectively or subjectively. The CFPB, the Consumer Financial Protection Bureau, did a lot of work on this topic and really defines it as being control over day-to-day and month-to-month expenses, the ability to absorb a financial shock, a plan to meet financial goals, and then the financial freedom to make choices to enjoy life. So as you can see, this is more of a subjective way of approaching financial well-being. And it's actually kind of what I'm referring to as I proceed further in talking about it in this presentation. So thinking about financial access, this is a concept that we use in research and practice, and it relates specifically to products and services that are affordable, convenient, and beneficial. And it also relates to fair and equal treatment from financial institutions. We also talk about, in terms of financial access, this idea of removing barriers to owning the necessary, beneficial, affordable products and services that people need to carry out their day-to-day financial transactions and behaviors. We're also talking about mainstream financial institutions as opposed to non-mainstream or non-banks. So we're really talking about banks and credit unions, those that are the retail services that are out there available for people. And we're not talking as much about payday lenders and check cashing stores and so on. When we think about these ideas of financial access, financial capability, financial well-being, I want to spend just a moment putting all these ideas kind of together in a model for us in a way of thinking about this. And so on this slide, I'm really borrowing from the work of Margaret Sherrodin, who's a pioneer in this area, as well as my colleague, Gene Wan, and his co-authors who sourced this model. But essentially, we think about financial capability, which is a term that is kind of a holistic term that describes the interaction of what people know and what people are able to do, their financial literacy coming from financial education and coming from financial socialization, what they learned growing up, along with their financial access. The interaction of those two really informs how people can function financially, and that together relates to their capability. It really defines their capability. And therefore, their capability influences their financial well-being, or the flip side of that is economic hardship. So when we think about financial access, we think about it as being an important component to people's overall financial behaviors, their choices, and then consequently their overall financial well-being. There's quite a bit of financial access research out there, and scholars like myself and practitioners as well are thinking about, like, when we think about financial access, are we talking about, real specific products and services? Are we thinking about other aspects of it? Like, what is it that we're really trying to measure or trying to promote when we're thinking about financial access? And so the research that I've done combined with what I've seen in the field is that it relates to a lot of different kinds of products and services. So there's a lot of focus on getting people banked, right? And we know that there's a small proportion of people in the US population that are unbanked, and we focus a lot on that as an important issue, getting people's foot in the door, a relationship with a mainstream financial institution, and that's really important. But we're also thinking about a broader basket, if you will, of financial products and services that can relate to people's overall well-being. So we think about various types of insurance, different kinds of accounts like retirement accounts, non-retirement investments, homeownership, consumer credit, and also financial counseling, coaching, and advising. And I'm not sure that list is really exhaustive. I think there's more that could be added, but that's a way of expressing this idea that financial access is really more than just having a bank account. And as I mentioned earlier, we also think about this idea that the products and services have to be available to people at all income levels, but also this idea that it should be affordable and appropriate and convenient and beneficial and reliable and secure. Like there's certainly qualities around those products and services that we need to also ensure. And it relates also to how institutions, how banks, insurance companies, and health insurance promoters, how they provide those to the public, and what are their policies and ways and practices. And then the last two bullet points on this slide really also relate to how individuals interact with these products and services out there in the market. That is, people are bringing their own resources and intrinsic qualities, their financial literacy and their financial behaviors. And then finally, they're also bringing their perceptions, right? Their comfort level in dealing with institutions, their satisfaction with the products and services that they have, because we know that we can provide people things that we think are beneficial, but unless they're comfortable with them and they use them and they're satisfied with them, it's not really going to help them overall toward their financial well-being. So what are some of the problems that we have sort of generally globally right now in the United States regarding financial access? We know that just a little over half of the population has a retirement account, either from their employer or otherwise. So there's a large chunk of the population that doesn't have any retirement savings in a retirement account. Only about a third of the population has investments. And we hear so much about how the stock market is doing, how the economy is doing. It really leaves out a large proportion of the United States population. About 40% have used non-bank borrowing methods in the last 5 years, according to the most recent FDIC data. So there's a large percentage of the population that really is pretty reliant on non-bank, non-mainstream borrowing methods. And we know that over 45 million people lack access to formal credit because they have no credit or very poor, a very thin file for consumer credit. And like a little over a third of Americans have worked with a financial advisor. So when we think about that basket of what it means to have financial access, that holistic basket, we can see that a pretty large chunk of the population is really missing out on that holistic approach to financial well-being. And then further, there's, of course, racial and ethnic disparities in the data. So just for example, I mentioned about 5%, 6% of the US population is unbanked, but we know that 11.3% of African Americans are unbanked and a very high percentage also of Hispanics. So there's a lot of skew to the data. We also know that there's been a substantial retreat of banks, in particular from some communities in the US, with a lot of mergers and acquisitions that have been happening. So people have less ability to interact with a mainstream financial institution that's conveniently located. And then we also know some communities still don't have reliable internet access. So when we think about, fintech and technology helping with some of these challenges, we still have a ways to go, right? In terms of people having reliable, affordable internet access that is secure for them, they can rely on for their transactions. And we also know that there's a lot of discriminatory practices and policies that are occurring still in these institutions, that people face those kind of barriers. So what does research tell us? I mean, what can we bring to the table in thinking about trying to expand financial access? Well, we know that using our empirical data, we know that it contributes even more to financial behaviors and financial well-being than does financial knowledge. So there's a lot of focus in our policies and practices, generally speaking, on improving financial knowledge. And that's really important. And I don't want to downplay the importance of those efforts. But we know that financial access is at least an equal partner in terms of an influence on how people behave in their financial decisions, their financial behavior, and their overall well-being. So I think there could be more focus on this particular topic when we think about financial well-being. My research in particular, what I found on this topic is that, certainly it's multifaceted, this idea of financial access. I looked at financial access kind of overall between about 2008 and 2020 or so, and looked at do better economic conditions coming out of the Great Recession improve people's financial access overall? Can people move from having poor access to better access, et cetera? And I wasn't able to find that in empirical research. So the conclusion is it may not actually improve with better economic conditions. It may be something that we really have to look harder at policy to really tackle. We know that bank account access methods, the way people access their account, whether in person or telephonic or internet, it really has a relationship with their overall financial well-being. And we also know that policymaking bodies like the CFPB I mentioned earlier are very important in this space. And they could, in fact, even think about taking stronger, more independent action to address financial access issues. They've been really, really active, during the Biden administration, doing a lot of wonderful things for consumers, and they could even continue that work and perhaps even take stronger measures. So again, going back to kind of the research that I've been able to do with partners, I've been able to see how financial access can buffer the impact of things like debt collection and income volatility on overall financial well-being, and it really does strongly influence people's financial management behavior. So lastly, I just want to mention that there's relationships here, I think, from the research to policy, and some broad kind of conclusions I would make. One is to focus, again, on this sort of broad array of products and services when thinking about financial access. I think more attention could be brought to minoritized communities and underbanked communities when thinking about financial access. There could be more of a policy focus there. I really have also seen the value of in-person banking in the data that I've been able to work with, and the importance of bank branches particularly to financially vulnerable communities. I think that it's important that, banks are somehow incentivized to provide good product information publicly. I did a study looking at bank websites and what information is out there about their bank accounts, and it's really hard to find and really hard to comparison shop. So I think some work could be done there. And lastly, I think it's important to support the CFPB. As I mentioned, they're a really strong and active consumer protection force in this space, and I really want to encourage all of us to continue to support them politically as best we can. So I want to thank you so much for your attention, and I'm going to stop sharing here and turn back to my colleagues. I think, Megan, you're free to take it away.
Great. Thank you so much, Julie. This is a really helpful way to set the stage for some of the things I'll be talking about today. And it's been a real pleasure to be part of this panel. So I'm going to take kind of a slice of the financial access concerns that Julie was mentioning and think about the availability of financial services in communities. So in this talk, I'm really going to be thinking about that local access to a bank branch compared to what happens when what's available in your communities are these non-bank financial service providers like payday lenders, check cashers, and remittance services that do offer needed financial transactions, but often do so at high relative price points compared to banks. So one of the motivations for my research to focus so specifically on the local geography of financial services is that we know that people continue to make financial transactions in person. So in a survey done by the FDIC in 2021, they found that about 92% of banked households in 2021 visited a bank teller, used an ATM or a bank kiosk at least once in the last 12 months. And these rates are higher for lower income individuals living in rural areas, and older adults. So as an example, 1 in 10 older adults used only bank tellers to discuss and manage their accounts. So this financial access is still happening, at least in part, physically, even with the rise of mobile and online options. And we have research that tells us that the proximity of services available is linked to their use. So if you live near an AFS provider, studies have found that that's associated with an increased probability of using one of those services. Likewise, if you live near a bank, that's associated with an increased probability of having a bank account and engaging with the banking system. There's also been a study that shows that if a local bank branch closes, this is associated with a subsequent decline in the probability of having a bank account, and actually a small increase in the probability of using an alternative financial service provider, or AFS in this talk. And as Julie mentioned, we're seeing kind of a retreat of banks from local communities. So this is a figure from The Economist, where they looked at bank branch openings and closings between 2005 and 2017. And they see that between, since the Great Recession through 2017, there's a net decline in openings, meaning there's more closures than there are openings in local communities. Certainly, branches are still available across the country. In 2017, the last year of data that they look at, there are 77,000 branches in operation, so they are available, but certain communities are starting to kind of feel their absence as branches close. In some data that I have on alternative financial service storefronts, we see a slightly different picture, right? These storefronts did decline slightly following the Great Recession and a little bit in the mid-2010s, but they have a little bit more stability in their growth patterns. They don't see that kind of net decline. So these are still very robust and present in a lot of communities. And as of 2017, the last year that I look at here, there were over 37,000 storefronts, including payday lenders, check cashers, auto title lenders, and pawn lenders. And one of the things I really think about in my work is about how these decisions to open a branch or storefront or close a branch or storefront are really active choices by the financial organizations themselves. And I think about this as institutional investments in neighborhoods. So for example, if a branch decides to open a storefront or a branch if a bank decides to open a branch in a certain community, they are making a decision to invest in that particular place. Likewise, if an AFS service provider opens a storefront in a particular community, they've decided to invest in that neighborhood. This is an investment that's certainly profit-oriented, right? Like any business, they want to make sure that they remain profitable. So they are thinking about certain neighborhood characteristics when they decide where and when to open or close branches and storefronts. And research has shown that this produces spatially unequal access to financial services. So we know that banks tend to branch in higher income and whiter neighborhoods, and alternative financial service providers tend to open storefronts in lower income communities and communities of color. And a lot of my work thinks about what this means for the well-being of communities, right? How does the spatially unequal distribution of services and the associated costs and quality of that service, how does that impact the broader well-being of the community? And so what I want to share today are results from two different studies that I've worked on, really trying to think about how the presence of these services can differentially impact community well-being. So in a first study that I did, I wanted to look at the type of financial service investment in communities and its associations with later poverty rates, kind of as a proxy for economic well-being of the community. And so what I do is I look at historical data on the locations of bank branches and alternative financial service storefronts, and I trace their long-term investments in communities by kind of classifying how long they stay in these communities and which communities they open in. And in this paper, I create neighborhood groups that are classified by the type of financial service investment that they've had. So over here on the left-hand side of this figure, this group of no investment represents communities that really don't see any financial services kind of opening and operating between 2003 and 2015. And then moving to the right, we have communities that really only see investments by alternative financial service providers. So these are the payday lenders and the check cashers, and these services that don't have as many benefits as banking services do. And then all the way to the right, we have kind of the bank only or mostly bank neighborhoods where if a financial service is investing in communities, for these communities, it is really majority bank branches. And what I show in this study is that even after accounting for a host of socioeconomic and demographic characteristics that we know are associated with poverty at the community level and financial service investment, the kind of sustained presence of alternative financial service providers in a community is associated with higher poverty rates relative to communities that have banks available, or even communities that have no financial service investment at all. So that's just one indicator that there is this relationship between the type of service investment and implications for economic well-being. In a second study that I did with colleagues Terry Friedline at University of Michigan and Megan Agnew here at UW, we look at an outcome around community health and well-being. We know that financial services have been linked to variation in individual level health and well-being. And what we want to see is if there's a corollary at the community level. And we look at the availability of payday lenders in a community. We kind of restrict our analysis to payday lending. And we find that the presence of payday lenders in a community is linked to higher rates of premature deaths. So this is kind of an extreme health outcome. We're looking at rates of premature death at the county level. And we see that for counties that have one or more payday lenders in their community, that is associated with higher rates of premature deaths. So this research is not to say that having a payday lender in a community causes an increase in premature deaths, but we do think it could be picking up on both individual level factors like economic strain that's leading to use of financial services like payday lenders, but also that it might be picking up on community level factors, right? A payday lending storefront, for example, might serve as a spatial marker of economic distress, as we know that payday lenders target lower income communities. And so that might be reflecting economic distress that's already existing in the community. And then its sustained presence in that community might further exacerbate economic distress and lead to additional hardship. So we see that there's the spatially unequal exposure to services in terms of the quality and the cost. And then we see kind of consistent associations with reduced well-being, both economic and health related. And so one of the things that I've been thinking a lot about in my newer research is to try to understand what policy interventions we might be able to leverage in order to reduce this geographic disparity in financial service exposure. Certainly, direct financial regulation is helpful, right? So in states that regulate the payday lending industry, we see a reduced presence of payday lending storefronts in local communities. But I argue that that's likely insufficient to change the financial service landscape in ways that are really beneficial to consumers, because direct regulation is not necessarily addressing consumer needs that lead to AFS use. So returning to that FDIC survey that I cited earlier, they ask unbanked individuals why they don't have a bank account. And there's a host of reasons that people give about why they're not banking, right? And so the blue lines here indicate a cited reason. They could pick multiple. And then the gray is main reasons why they're not banking. And one of the things that stood out to me is that a lot of these are related to cost, right? So banking can be really expensive if you are a low-income family, right? You have to, for a lot of banking organizations, there might be minimum account balances or other monthly fees that get hard to sustain. And so my colleagues and I wanted to understand that what if we reduced income insufficiency, right? The kind of cost associated with banking through direct financial support of families, right? And so in this study that I did with my colleagues Mari Amarim at Washington State University and Terry Friedline at University of Michigan, we tested the idea that if we increase the generosity of our social safety net by giving individuals more financial support directly, maybe we would see a reduction in consumer demand for products like payday loans. And through that demand, we might actually see creditors leave local communities. So we looked at a number of different social program packages. I'll just kind of preview our results for SNAP, which is the Supplemental Nutritional Assistance Program. And what we find is that payday lenders are sensitive to changing generosity of the social policy environment. In particular, as SNAP benefits became more generous, we saw the growth rate decline and actually turn negative in some instances among payday lender storefronts. So payday lenders started to leave the state as poor families were better supported through policy programs like SNAP. There's certainly a lot more work to do in terms of policy solutions that can address these inequities in the local access to financial services. But this is just a preview that some non-direct regulation avenues might be possible. And here we're thinking about social policy. I'll stop there because I know Karen is going to talk a lot more about additional solutions to better support families. So thank you very much.
Thanks, Megan. I think both you and Julie have set me up perfectly. We've heard the research about access to financial access. And what I'm going to talk about now are some of the innovations on the ground to address financial access and also to address that fact that Julie started her presentation with, the fact that so many people are struggling with financial well-being. So as Judith mentioned in my introduction, I really wear two hats. I have an individual consulting practice that focuses on financial security, and I'm a program manager at Asset Funders Network. So I'm going to bring lessons from both of those places to talk about, give examples about strategies to increase access and also identify some innovations on the ground that really address policy and practice strategies to address systemic barriers that undermine financial security. So let's go to the next slide. So I'm going to craft my presentation around what I'm calling the 3 Ps. I'm going to talk about examples around products. So I will share an example of a product that's part of the Financial Wellness at Work program that helps increase access. I'll also talk about some practice solutions, some actionable strategies that address systemic debt. And I'm going to use the example of the Southern Partnership to Reduce Debt. And then I'm going to talk about some policy advocacy strategies, and I'm also going to pull those from the Southern Partnership to Reduce Debt. Let's go to the next slide. So I mentioned the Financial Wellness at Work program. That's a program that's administered by the FINRA Foundation in conjunction with United Way Worldwide. And the Financial Wellness at Work program, it supports a network of nonprofit organizations that work with small and medium-sized employees. Their goal is to provide workplace financial wellness services, and they provide these services in the workplace during the workday. So whatever hours the workplace takes place, they deliver services during work. And we have over 30 organizations that participate in this program, and they deliver a variety of services. So financial education workshops, one-on-one financial counseling or coaching. In some cases, they provide public benefit screening or free tax preparation services. And the other important service that they provide in many cases is an affordable loan product known as the employer-sponsored small dollar loan. It's an alternative, as Julie was talking about, non-bank borrowing. This is a non-bank borrowing alternative that really gives another option to payday lenders or title loans. So let's look at some of the characteristics of this loan. Let's go to the next slide. So what this slide shows are the optimal parameters of the Financial Wellness at Work employer small dollar loan. And so I'm going to highlight just a few of the things on this slide. So just at a high level, you should know that these loans are small dollar loans. So they're generally up to about $2,000. And they're made available to employees of participating employers that offer this product. And the loans are repaid through payroll deduction. So to qualify for the loan, it's not based on credit score. Instead, it's based on employment tenure, and good standing with HR. The interest rates are roughly between 16 to 18% for a loan term that ranges from 90 days to as much as 12 months. And then repayment is reported to the credit bureau so that this is a tool that can help employees either establish credit or improve credit. And it can also help them save. There is an opt-out savings feature with this loan that after the loan is repaid, a deduction in the amount of the loan installment can continue into the employee's a savings account. Again, that is an opt-out feature, but these are the parameters that FINRA Foundation promotes for ESSDL. This doesn't mean all employer-sponsored small dollar loans have these components, but they are the optimal components. And I'd like to give you just an example of how this loan has increased access for a particular employee that used it. So I'm going to tell you a story about Paul, and this isn't confidential information. Paul has created a video, and there's been written information documented about this, so I'm not breaking any confidentiality, but Paul was an employee of Rhino Foods, which is a company based in Vermont that makes cookie dough. And after making a tax mistake, Paul found that his credit was severely damaged and he couldn't get any loans. So he took advantage of the employer-sponsored small dollar loan. He knew he was guaranteed to get it because he was an employee in good standing, and he borrowed $1,000. And he really appreciated the simplicity of the product and that he was able to repay it with payroll deductions. So he used that loan really as a credit building tool, and he repeated that process 5 times, each time repaying the loan, hoping to boost his credit score. And ultimately, when he needed a car loan, he was pleasantly surprised to find out that his credit had improved. He was able to qualify for the car loan, and he was able to make his first new car purchase in his mid-50s. So he was very excited about that. But it didn't stop there. Again, because his credit had improved, over time, he was actually able to qualify for a mortgage loan. He and his daughter bought a home together. So it just shows how that ESDL product was almost kind of a gateway product that provided access to auto loans, mortgage loans, and also importantly, gave him a relationship with a credit union that he was able to continue building over time. So let's go to the next slide. I want to go to another example that really focuses on practice solutions. And I'm going to talk about some work from the Southern Partnership to Reduce Debt. So I want to spend just a minute explaining what this initiative is. And the Southern Partnership to Reduce Debt it's a multi-year, multi-state initiative. It was launched by the Annie E. Casey Foundation in 2017 with a goal of closing the racial and the racial ethnic wealth gap, and also to improve financial security. The initiative, as you can see on the slide, it involves several national partners. It involves several state organizations working in the 7 states that you see on this slide. And each of the states were focused on 4 types of debt. There were 4 types of debt that this initiative focused on: public sector fines and fees, medical debt, student loan debt, and high-cost small dollar loans. And as you see on the slide, AFN was one of the national partners. So we spent a lot of time kind of extrapolating the lessons on the ground and figuring out the role of philanthropy in addressing debt as well. So let's go to the next slide. And I want to talk specifically about medical debt. As I mentioned, that was one of the 4 types of debt. And I want to just lift up 2 kind of examples of work on the ground to address medical debt. But what I want to just show, and I'm sure I don't need to preach to the choir on this, just the impact of medical debt. This slide just lifts up some stats about medical debt. And I'll just add to the slide, one of the things I want to make sure everyone realizes just how widespread this issue is, that 79 million Americans struggle to pay their medical bills or are paying off medical debt. And it's not just a financial burden. People actually hesitate to seek care because of medical debt. So it's a significant challenge. But the good news is that there are efforts out there to address medical debt, and I'm going to highlight just a couple. So let's go to the next slide. So what you see here is a chart that appears in an issue brief that AFN developed with the Aspen Institute Financial Security Project. And we outlined kind of 3 different kind of pillars of ways to attack medical debt. And I'm going to give an example of two examples that are listed in bold on this slide. And I'm going to start with the first, with the strategy of preventing medical debt. What are the kinds of things we can do to prevent it? And I want to lift up some work in Tennessee, the Tennessee Justice Center. Their strategy to prevent medical debt was by connecting consumers to insurance. And given that hospitals frequently engage with uninsured patients, the Tennessee Justice Center leveraged their legal expertise to navigate the intricacies of the Medicaid system. Their focus was to identify some of the often overlooked eligibility categories that could offer coverage to individuals that didn't qualify under some of the more common categories. And between 2019 and 2023, the Tennessee Justice Center prevented more than $7 million of medical debt by expanding coverage for uninsured individuals through these effective collaborations with hospitals. Now let's go to look at the last box. Give an example. This last box talks about the strategy to mitigate the effects of medical debt. And this one strategy is by canceling it. So I want to just lift up some work that was done in Arkansas, where a group of foundations and donors raised more than $225,000 to erase $35 million in medical debt. So they were able to purchase this medical debt for pennies on the dollar. And as a result, close to 24,000 Arkansans in all 75 counties of the state benefited with an average eliminated medical debt of approximately $1,500 per individual or family. And as a part of that effort, they also developed a set of policy recommendations so that they were also doing work to prevent future medical debt. So again, lots of great work going on the ground around addressing systemic debt. And I want to lift up one other strategy, if we could go to the next slide. And this is looking at policy and advocacy and the role that policy advocacy can play to address some of these systemic barriers that undermine financial security. And what this slide shows are burdensome fines and fees. And so this slide shows just the variety of fines and fees that exist across the country. You can see, if you can see the slides in the text, these fees vary in specificity, they vary in amount, and there's not any real pattern to the fees that exist. And if you look at the fees, you might think, well, that doesn't seem like a very high fee. How is this impacting financial security? But the amounts may seem small, but their consequences can be severe, especially for those with low incomes. They can often lead to job loss, credit score decline, and even jail time for unpaid fees. So let's look at the next slide to look at some more impacts, because it impacts not just the individual, but there is also collateral impacts for these fines and fees. And I want to just acknowledge that fines and fees have been, so I'm not going to read all the bullets on the slide. You can see those and see the impacts, but I want to lift up and make sure everyone understands that fines and fees have been around for a long time. They've been a component of our judicial system, but state and local governments have increasingly been turning to fines and fees to make up for budget shortfalls. And over the last decade, all but 2 states have increased civil and criminal fines. So it's been increasing. And it's also important to talk about who these fees and fines impacts. There was an investigation done in 2015 of the Ferguson, Missouri Police Department. And that investigation, in addition to subsequent research that happened afterwards, it's shown that the fines and fees disproportionately are levied on communities of color, derailing opportunities to build wealth and also perpetuating the wealth gap. So fines and fees are a significant barrier to financial well-being. So let's now go to some good news and talk about some solutions. Let's go to the next slide, where it shows the 7 states that were participating in SPRD. If we could advance to the next slide. They have all addressed fines and fees in some ways from a policy and advocacy position. And I want to focus on North Carolina. On my screen, it doesn't look like the slide is moved. I don't know if we can advance that. Okay, they're working on the slide. I will tell you about what happened in North Carolina. So in North Carolina, there was some research that was conducted, and it showed that one of the most consistent and clear barriers for justice-involved residents is a suspended or revoked driver's license. And driving with a revoked license is the 6th most common charge, and it constitutes thousands of arrests in Durham County. These charges disproportionately affect Black residents who make up over 75% of the revoked license charges. So the SPRD partner in North Carolina, the North Carolina Justice Center, they were instrumental in launching the Durham Expungement and Restoration Program, or DEAR as it's known. They launched that in 2018. And the DEAR program was aimed at assisting individuals who are unable to pay fees associated with traffic infractions. And they also worked with the Durham District Attorney's Office to resolve all traffic charges that were causing long-term driver license suspensions for Durham residents. And between 2018 and March of 2021, the DEAR program waived $3 million in fines, putting more than 15,000 drivers back on the road. So I just shared a very quick overview of some of the product, policy, and practice solutions that I'm seeing on the ground that increase access and also that address systemic barriers that undermine financial security. But to learn more, there have been a variety of publications that summarize this work. So they are included with links on the slides. So with that, I'm going to turn it back to Judith.
All right, thank you so much. And sorry, I was trying to jump in there and maybe be able to advance your slides, but I couldn't find my way around. But thanks to all 3 of you, and I'll ask Julie, Karen, and Megan all to join me for the Q&A. And we've had some really great questions submitted before and actually during the presentation. I think one of the interesting things, and I'll direct this to Megan, is that often the alternative financial services, especially payday lenders, are seen as an evil, and that there have been calls for eliminating them, or at least, capping them severely, which I believe could lead to them just leaving or not providing services. And it does seem from your research that they are filling a need, and that communities might have even fewer resources if they left. What's your position on kind of what the ideal landscape would be, and to make sure that the different services are being provided as needed?
Yeah, that's a great question. Yes, so often the policy focus, and I'll talk about payday lending in particular, the policy focus has really been on direct regulation, and usually that's through changing the pricing or the structure of the loan. Sometimes it does make the loan more affordable for individuals, but often a consequence is that the payday lender just leaves entirely, and it kind of leaves this gap. And so that is one of the reasons I'm really interested in thinking about kind of complementary policy solutions that address the need for using payday loans in the first place and why they tend to cluster in lower income communities. So thinking about more concretely the reasons why people who don't have bank accounts or don't use bank-based credit, understanding why they don't use that bank-based credit, I think can help us address these underlying needs that kind of shift people into AFS use. So one of the things that, I've been tackling is the cost piece, and just having kind of this income insufficiency problem where people need access to cash, they don't have savings, and so they're turning to payday loans to make ends meet. Can we do something on kind of the income side to increase savings, increase their buffers so that they can actually better manage finances? One way to do that would be social policy. I think another direction would be think about the costs of banking services, right? And we're seeing some banks actually reduce their fees, right, in recent years and make that service more affordable. And if there's kind of consistency in that and people can, reliably bank and not worry about so many fees, that might actually help as well.
Great, thank you for
Julie
that.
wants to add in, yeah.
Yeah, I was just going to add too that one of the things I'm musing about and interested in, there's a lot of guaranteed income pilot programs going on across the country, which is another way to increase people's basic income. And I don't know what the outcome will be, and I don't know if those pilots will go on long enough that you could actually see a difference in those communities. So that's an interest. But I would love to see, if some of those similar findings we can see the similar findings across those pilot programs as well, and looking at whether if people have, $500 a month over, 4 to 5 years, that makes any sort of substantial difference in what's offered in their community. So I think there could be some exciting research findings that hopefully can inform the kind of work that Megan's already done.
And I'll just do a quick plug. The communications team here at IRP is actually working on several products about guaranteed income. So stay tuned. Since you registered for the webinar, you will be getting information about the webinars, podcasts, and some written material. So thank you. Thank you for teeing that up for me, Julie. And Karen, did you want to add anything on that?
I was just going to build on what Megan said about trying to understand why people use these services. I mean, one of the things we've heard about feedback about the employer-sponsored small dollar loan, one is trust. I mean, I saw that on the slide that's a barrier. They don't trust financial institutions. So thinking about not just the product, but like how it's delivered and how you create that relationship and build the trust. And convenience was just another factor that we heard in terms of why the ESDL was an effective product, that it was delivered in a place that was, super convenient, the payroll deduction, so those kinds of things. So I think it's not just the price, but the features of the product and how it's delivered are very important.
Thank you all. A question about that access and what kind of where people are at for other reasons, perhaps. And I know there have been suggestions of perhaps there should be post office banking. There was also a question about private sector partners with a presence at the street level and whether they could be realistic partners in extending financial services. And the example that this person gave was the city of Madison here just brought a bus rapid transit system online and made it possible for people to reload their physical fare cards by paying at, for instance, a convenience store. Have any of you seen examples of those kind of partnerships or bringing services to people instead of people having to go to the services? I'll let whoever wants to start. Karen, can I call on you?
Yeah, you can. And I was hesitating only because I don't know that this is a direct answer to your question, but this idea of bringing services to the person is really kind of how the Financial Wellness at Work program is modeled, in that they are embedded. They have people embedded in the workplace. So they know, like each employer knows on certain days, there will be a representative so that, if an employee has they need connection to a housing program, or they need connection to childcare assistance, there is a resource that is available to them, that they come to them. So again, that convenience factor. So I can't give an example though of a private sector partner, although they do have things like access to like Metro cards, things like that, if that is a barrier to work. So I guess that might be a way of connecting the private sector. But so I don't know that it exactly answers your question, but
great information.
For that, bringing the services to people is something that eliminates a barrier and is effective.
Julie?
Yeah, I'm so glad, Karen, that you jumped in. It took me a minute to think about this example, but in recent years, I've really seen, I'm in St. Louis, and I've really seen around the St. Louis area, we have a wonderful community of credit unions that have sent out remote workers into more larger scale social service agencies where they have offsite tellers basically working within community centers and nonprofit organizations, and are there in the late afternoon and early evening hours and are bringing banking essentially outward. Along with that, they're providing financial coaching at the same time. And so I just want to give a shout out to the credit unions who, according to what I see locally, are kind of a leader in bringing those banking services directly out into communities of more financially vulnerable people.
And I will say we have several folks who have identified themselves as being from credit unions on the call today. So great to have them there. Megan, was there anything you'd like to add?
No, I think those are great responses. I agree that some of the barrier is being able to make it to a particular location to manage financial transactions or manage accounts. So the more that we can do to reduce that physical barrier, the better. So.
Great, thank you. We had a couple questions that feel like they're tied together, so I'll try to wrap them up in one, more or less. We had a question about financial system access for immigrants with varying immigration status. And the question that I thought tied into that nicely was about transfers of money internationally, particularly for people who work in the US and send money back to family in their home countries. How do you see the remittance system intersecting with what we've discussed today, and how do perhaps undocumented people interact with financial systems? I know you're not supposed to ask double questions, but I did. Megan, maybe I'll start with you.
Yeah, so remittance services are really important, particularly for communities where there are more residents who are immigrants and they're sending money back to family. I think this links a little bit to the question around trust that Karen raised. So often non-bank remittance services are preferred because they're just kind of one-time transactions and you don't need to worry about having an account and kind of having more sustained interactions. And I think there's a lot of work that our financial institutions could do to improve trust when it comes to banking, particularly if you have, a status as undocumented or you're hesitant to kind of reveal that status to financial services. And on the broader question of trust, I would just note that a recent Gallup poll said that only about 27% of Americans have a great deal or a lot of confidence in banks and banking institutions. And I think that signals a larger cultural problem around this hesitancy to use these services that we need to address, not just for certain, populations like immigrants, but I think more generally in the population, it's a problem we need to think about more.
Great, thank you. Julie?
Yeah, I was just thinking, I just finished a study where I did a in-depth examination of complaints to the CFPB about bank accounts, kind of looking at those and categorizing those and kind of digging in, which was very eye-opening. And it's just about the larger national banks. The smaller ones, they don't publish. But it was interesting about trust was a really common theme among those complaints. And people really, I want to sort of call out maybe something we haven't yet discussed, which is the person-to-person interaction in those banks and well, these are banks was a data set, is like really, really important. And I think that maybe the banking industry could really consider perhaps creating more universal standards around customer service and really try to standardize more how people interact with people around various issues. There seems to be a wide diversity of experiences, with many customers having great interactions and some customers having horrific interactions with representatives of the larger banks. And it really doesn't help, the trust issue when you have these really challenging interactions with, it feels to people sometimes very arbitrary kinds of decisions from frontline staff who may be operationalizing their own internal biases without even realizing it, So anyway, I think we have some work to do from that end, and perhaps some standards or standardization among customer service interactions could be one step toward higher trust level.
We have just a few minutes left, but one of the things I love about our webinars is we have so many people who are working directly with the populations, the communities, the individuals that we're talking about. And there's often in the chat and in questions that are submitted, a real desire for concrete ways that they can help the folks that they're working with. And I guess I'd like to ask each of you if you know of particular resources that could be useful for people working in frontline agencies, social workers, and whatnot, or just kind of a nugget of information that you think will help them help the folks that they're working with. Julie.
I'll jump in. I don't have a program per se. I just want to give a shout out to the Bank On movement that's been going on around the country for a number of years, and the good work they've done in creating Bank On coalitions in major cities and perhaps even outside the major cities.
Can you say just a little bit about what Bank On is? Because that's new to me.
Sure. So Cities for Financial Empowerment Fund, which is a nationwide nonprofit organization, has been working at the problem of the unbanked for many years. And part of their work, they do a lot of things, but part of their work is to sponsor and try to help organize these coalitions that are local in major cities, where you have nonprofit organizations, the banking community, and advocates come together to try to figure out local solutions to try to help folks, a larger proportion of the community be banked, and also create banking products, meaning accounts that meet specific standards that are affordable, convenient, all the things I mentioned earlier. And those coalitions have done great work around the country and been really focusing hard on trying to lower the unbanked rate around the country. So just want to give a shout out that there may be those kind of coalitions operating in people's local community. And it's a way for the nonprofits and the banking community to interface around the issues that really face financially vulnerable populations.
Great, thank you. Karen?
So I had two ideas. One, it follows on something that we were talking about, and that's just understanding what your clients, your customers, your consumers need. So engaging them, making sure that the voice of customer informs everything that you do, that it informs the design of your programs, it informs the services that you provide. And then once you understand what they need, I love this idea of how do you bring the services to them? So, if bank access is a challenge, is there a local bank, a credit union that you can partner with, that you can help to kind of build that bridge so that they get to know the organization and, build the trust so that they feel comfortable using the services, is something that I think all of you are in a position to do, because you have that trust of factor already, and you are in touch with the community residents that need that service.
Thank you. And Megan?
Yeah, I would just add that as many on the call may know, there are some great organizations that produce reports and working papers that are publicly available and easy to access. So folks at the Aspen Institute, but also resources through the CFPB itself, the Consumer Financial Protection Bureau, they have a lot of things that you can point folks to that you're working with. So if someone's buying a home for the first time, they have a great kind of how-to aspect of their website that you can actually walk through and understand what the process is going to look like. So some of those resources I think are really helpful, but maybe not as well known, and I'd really encourage folks to check them out.
Great. Thank you all. Those were all great suggestions. And that brings us up to the end of our webinar. Thank you so much to Julie Birkenmaier, Megan Doherty B, and Karen Murrell for sharing their time, experience, and research with us today. And thanks to Natea Taylor for handling the tech for the webinar. As we mentioned before, we'll be posting the slides and the recording of the webinar within a day or so. And if you registered for the webinar, you will receive a link to those by email. So once again, thanks for joining us today, and have a great rest of your day. Take care.